65 webinars. 65 webinars in SLU webinar series. Today our topic is locomotor diseases in poultry. Our resource person is well-known resource person for this special subject. Dr. Tiago Rucha and Dr. Hilde van Mierage. Thank you very much for accepting our invitation on behalf of Sri Lanka Veterinary Association. And today our moderator is Dr. Tushar Gunawardena, Sri Lankan veterinarian. Without getting much time, I would like to invite the President of Sri Lanka Veterinary Association, Professor Dilan Sakrasia, to welcome you all. Dear President.
Yeah, thank you, Dr. Sugat, for your initiation. And first of all, on behalf of Sri Lanka Veterinary Association, I would like to warmly welcome you all from all the continents who joined to this poultry webinar series. And also, I must first appreciate the willingness and their contribution by our resource person from VetWorks, Dr. Hilde and Dr. Tiago, on their commitment on agreeing with Sri Lanka Veterinary Association to have this webinar series. Actually, we have last couple of months, we had some trainings in Sri Lanka with another funded project by Kingdom of Netherlands. And with that relationship, we started this webinar for Sri Lankan poultry veterinarians as well as industry and all the poultry veterinarians who are working in the industry. I'm sure this webinar will be very fruitful and productive for improving our knowledge. So this is one of the main objective of the Sri Lanka Veterinary Association, uplifting the professional knowledge of veterinarians in Sri Lanka. So this is the largest professional body in Sri Lanka who represent veterinarians. Over 1,500 veterinarians are members locally and internationally. So without making much time, I'm handing over the forum to today's moderator, Dr. Tushar Gunawardena, poultry pathologist and also senior lecturer in Department of Pathobiology, Faculty of Veterinary Medicine and Animal Science, University of Peradeniya. She got the PhD in poultry pathology in the University of Saskatchewan, Canada. So, Dr. Tushari, thank you for accepting our invitation and moderating the session. Over to you.
Thank you, Dr. Dilan. So it is an honor to moderate this session today with two well-known expert resource persons. So it's my duty to introduce them before their presentations. So as we have two presentations, I will introduce the first presenter today first, and then after his presentation, I will introduce Dr. Hilde. So our first presenter is Dr. Tiago Rucha. So I'll give a brief introduction about him. Dr. Tiago Rucha graduated from Veterinary Porto University, Portugal, and gained experience working in a poultry production company before joining VetWorks as a poultry consultant in 2018. Dr. Tiago provides his expertise in poultry production and health, especially on gut health and business development, to provide global technical support and business development advice to the poultry industry. So, in addition to his consultancy work, Dr. Tiago have completed an MBA in 2020 and a post-graduation in neuromarketing in 2022. That expanded his knowledge in business strategy and consumer behavior. So with the passion for the poultry industry and a dedication to staying current with the latest trends and innovations, Dr. Tiago is a well-equipped personnel to provide valuable insights and guidance to clients at every stage of the industry. So today, I invite Dr. Tiago to talk about locomotory problems in poultry. That's the topic of his presentations. So over to you, Dr. Tiago. We look forward to have questions at the end of the session. So if you have any questions, we can have it typed in the chat box and we can get it to Dr. Tiago at the end of the session. Thank you.
Thank you very much. I trust that you hear me well. Well, that you hear me.
Yes.
Yeah, you just.
Thank you for the introduction, Dr. Tushari. First of all, I would like to thank everyone, and it's a pleasure to be here and to continue to contribute with Sri Lankan poultry industry. It was a pleasure being there, and we are more than happy to support you in any way we can. With that being said, and without further ado, I will start my presentation. So we were invited, as Dr. Dylan said very well, a couple of months ago, we were there and we were invited to give a talk on locomotor disease, or on several topics actually, but we got to a conclusion that this would be not only relevant to discuss, but also a key point to improve industry. So an easy way to improve knowledge and know how to improve. So I will be doing a small presentation on the introduction on locomotor problems in poultry. And with this presentation, my aim is to show you the importance that locomotor diseases have in poultry, and the huge link that or the challenge that creates these types of problems, and how come locomotor problems appear like one of the main pillars for this. So if we think about the broiler industry that we have nowadays, for several decades, we have been improving performance, and for that we needed a couple of key actions. So for one side, we had to improve nutrition, improve genetics, improve environmental conditions to allow us to have the intensive production that we have nowadays, which led to high daily weight gain, so better performance, and shortened production cycles, which in very short is improving the industry like what we have nowadays. Well, this is all very good, but what happens is that with our chickens, we start with a very small chick that has 30 to 45 grams. And in very little time, so 30 to 45 days, we get to 2 kilograms. And what happened is that the evolution of the weight that we had throughout the years or throughout the decades, not all the systems evolved to support this development or this genetic selection that we did throughout time. So some systems started to, let's say, collapse, or we started to see more problems linked with that. And that's the case with locomotor disease. The bone is a key component, obviously, or one of the key systems to support the muscle. And the fact that we had such a huge development in such a short, let's say, period of time, made it that we have these types of problems. There are several things that we have to take into account in bone, and several components. First of all, bone is a very active organ. We have a constant remodeling of osteoclasts and osteoblasts. Those are cells that both, let's say, destroy and create bone, or are always in constant equilibrium. And this reabsorption and creation of bone creates this equilibrium on calcium and other types of minerals. We also have the medullary cavity, where we have the formation of some specific cells as well. On the other hand, we also have joints that serve to decrease friction and distribute stress. They are avascular, a neuron, and aliphatic, and they receive nutrients and oxygen from synovial fluid via diffusion. They are very difficult to reach with drugs due to the fact that they are avascular as well. So what does it look like in real life? This is a picture of a tibia on a broiler, where we can see cartilage, the cartilage of the physial disc, the bone marrow here, and the cortical bone on the lower picture. This on a more general picture on the bone. So function on the bone, we have the mechanical support, as I said, protection of organs, leverage, movement, hematopoiesis. So we have the formation of the red bone marrow as well. It serves as well for storage for adipose tissue, where we have the yellow bone marrow. This equilibrium on minerals also happens in some way there, where we have the hormones regulating the activity of these osteoblasts and osteoclasts that change the concentration of calcium that we have in the bone, where we have the parathormone and the calcitonin having this effect on the osteoblasts and the osteoclasts. As I said, we have a very quickly growing animal that creates a lot of stress on the bone and creates a lot of the problems that we see in our chickens. And this fact creates the problems that we have nowadays. The bones in chickens have some specific characteristics. As we know, chickens were made to fly, so bones are less dense, and we have what we call pneumatic bones, which are bones that have empty cavities, let's say, that are part of the air sac, such as the case, for instance, of the skull, the humerus, the clavicular, all these ones that are in green, in fact. Besides that, we also have some fused vertebrae and some free thoracic vertebrae. This is important specifically for some diseases that we have on the locomotor system, that the fact that we have this fused vertebrae plays a role, but we will talk about that in the second presentation, I think. And then we have the sternum, which is a big surface to attach the pectoral muscles that we have in our chickens. So to ensure optimal performance in broilers, we have to focus on house management, intestinal health, respiratory health, and locomotory health. So we understand that this is one of the key components to maintain a good performance and to attain the aims that we go for in production. So what we have to do, sorry, as a vet, to examine if we have any locomotory issue. Well, the first thing that we have to think about is when we enter a house, try to define an area of the house that we that it's easier for us to define if we have any lame birds. What I usually try to do is try to picture in my mind 1 square meter when I enter the house. And I try to count the number of birds that I have there and do an estimate of the percentage of lame birds, percentage of skin scratches, type of lameness that I have, the condition of the litter in general. And then after that, I can examine also live lame birds, for instance, to see if there's any pain response in the legs, and then try to have a more holistic picture on the water management, on the feed management, in order to understand, okay, if there are any problems, what are the root causes that I have here? Most very commonly, these types of problems come from a multifactorial picture where we have several causes coming into play and having an influence here. So what we have very commonly is birds that have less mobility or lameness are associated with footpad dermatitis, with femoral head necrosis, with tibial dyschondroplasia. And what happens is that these less mobile birds, or these birds that have less ability to walk, will crouch, and the other birds will walk over them. That will create scratches, and on the slaughterhouse we see lesions like this one that are mainly caused by scratches, and this is one of the signs, let's say, that we have locomotory problems in a house. And one of the things that we see also in the slaughterhouse, and that can lead as well to some rejections. On the post-mortem examination, what do we look at? Well, we first try to understand. I always say that when we do a necropsy, it's very important to understand, first of all, what is normal, so we can see what is abnormal. The first thing that we have to do is, after absorbing, if we have any bone deformities, if we have symmetry on the bones, if we have any spinal pathology, any abscess, deformation of the vertebrae. It's very common that we have these abscesses in the spinal, in the spine, just before the fused vertebrae, but I think Hilda will touch on that. And then we have these tendon and muscle lesions. If we have any stifle or hock joints, hip joints, if we have femoral head necrosis, foot pad lesions, which I will show in a second, and try to understand what are, after observing this, try to understand if we have any problems. Probably the most important factor on locomotory health is wet litter, and wet litter is a very complex problem that can have multiple causes, and the first one, or the most common one, could be bad management, but in fact it's a very multifactorial problem where we have litter playing a role as well, the type of litter, the absorbing capacity of litter, the management inside the house, but also the gut health in our broilers, the diet, for instance, and everything ends up playing a big role in the condition of litter that we have. Specifically for gut health, we have so this is the vicious circle of bacterial enteritis, where we try to explain the root cause of bacterial enteritis, let's say, without going into very much detail and just giving you a quick picture. Bacterial enteritis is an imbalance of the microbiota that we have in the chicken's gut, where we have bad bacteria, let's say, playing a role on some morphological and functional alterations in the gut. Everything starts with a damage of some kind that impairs the ability of the gut to absorb nutrients, and from there, the fact that our gut cannot, or the chicken's gut cannot absorb nutrients, creates an oversupply of nutrients present in the lumen. So because they cannot absorb, the availability of nutrients increases in the gut, which creates this shift in the microbiota and these bad bacteria that I'm talking about, and starts to create morphological and functional alterations in the gut that then leads to poor digestion of feed and absorption of nutrients, that then leads to this oversupply of nutrients. There are several things that these bacterial enteritis cause after. The first one being wet litter, because the humidity of the feces will increase as well. We have poor absorption of nutrients, for instance, of calcium and other minerals that will play a role as well on this equilibrium that I just mentioned before. Also, we have a less ability of the gut to block the passage of this bacteria, which then sometimes after passing through the barrier of the gut, they go through the bloodstream and they deposit themselves in some specific locations. For instance, in the spine, in the femoral head, causing these problems that I just mentioned, such as the abscess, such as the femoral head necrosis. It's not all linked with bacterial enteritis, but this plays a big role. But the genetics here also is a very important cause to take in account. If we look at the skeletal disorders that we have in broilers, or in chicken in general, we can split them in two main groups. One, the infectious causes, and the non-infectious causes. I will focus now in the non-infectious causes, and then I will pass the word to my colleague, Dr. Hilda, and she will explain the infectious ones. So in the infectious ones, a lot linked with what I just explained on this poor ability of the gut to block the passage of these bacteria. We have the femoral head necrosis, the spinal osteomyelitis, the mycoplasma, the reovirus, and then on the non-infectious causes, we have the spondylohepatitis, the rotational and angular deformity, the rickets, the foot pad dermatitis, or heartburn or breast blister, any dermatitis or contact dermatitis, let's say, that we have in our chickens that is linked with wet litter, will play a role or can cause potentially a locomotor problem, but also it can also be a gate for these bacteria that can allocate themselves in specific parts of the gut. So we start with spondylohepatitis, which is basically a vertebral deformity or displacement that leads to a compression of the spinal cord that then leads to some paralysis. This is usually linked with a genetic factor. Actually, all of these problems that I will mention, not including the foot pad dermatitis, although there are some genetic component playing a role there. All of these affections that I will speak now, they have genetic components, so congenital, let's say, components here. So this spondylohepatitis has no pain response. We see lameness, and mostly we see these thoracic vertebrae causing this paralysis. It can also we can also see this in the abscess that I just talked about by the enterococcus, where we see this paralysis being caused by the compression of the spinal cord. We also have these rotational and angular deformities, where we have the valgus and varus, which is the placements of the feet if it's towards the outside or towards the inside, like what we have here. And which then obviously will have an impact on the abnormality of the load that is applied to the growing bone. Here we see an example of a right leg that is normal and a left one that has a lateral twist. And here we have a lateral torsion of the tibial tarsus. So it's not that the bone is curved per se, but is twisted, which then causes obviously some impact on the locomotion of our birds. We also have rickets, which are basically a deficiency, or that are caused by a deficiency of calcium, phosphorus, or vitamin D. We have this deficiency of calcium is usually caused by a failure of mineralization that will lead to more plastic or more or less fixed bones, more flexible bones. That is caused mainly by the fact that our birds grow very rapid, and then the bone or the deposition of these minerals doesn't happen as it should. So we end up having this rubber skeleton and lameness very commonly as well. We have these hypocalcemic rickets and the hypopotaemic rickets as well. The hypocalcemic are calcium deficient, and the other ones are phosphorus deficiency. On the other hand, we also have tibial dyschondroplasia, which is basically this large vascular cartilage plug that we have here in the tibia, that basically is also an imbalance on this calcium phosphorus equilibrium, that then leads to these to this plug, and then in some stages to lameness as well. On the dermatitis part, we have foot pad dermatitis here. So the main etiology, as I explained, is wet litter, although it can have multiple causes. The wet litter, as I explained, it can be linked with poor environment, dietary factors, enteric disease, excessive drinking, choice of litter material, stocking density, for instance, the product that we are using for coccidiosis control can have an impact. So as we can see, it's a very multifactorial disease or problem that then leads to this affection that can be very difficult to get a hold of. What we see is lameness, short tendency to lay down periods, reduced feed intake because birds tend not to move as much as they would. And when we examine it, we have this erosion, discoloration of the skin, and ulcers. They have several stages that we have to keep in mind, and they actually are scored in Europe, and they are a welfare indicator. So this is one of the key indicators that slaughterhouses use to measure the welfare in the farm, and to see we have several densities that are allowed, let's say, and a farmer can only go up in the density that is allowed to practice in his farm if the score of the foot pad dermatitis is lower than a specific number. When we score this foot pad dermatitis, we usually see these lesions, this discoloration that I mentioned. We have in the score 3 different scores, so 0, 1, and 2. In the 0, 1, we have no lesion and slight discoloration, like what we have here. Score 1, we have the superficial lesion, hyperkeratosis, and discoloration of the foot pads. And on score 2, we have severe deep lesion, dark discoloration. We have the formation of this crust and the swelling of the foot pad. After this, what we have, or the evolution of the score 2, is the bubble foot, which is when we have the birds was able already to, let's say, seclude the foot pad dermatitis, and after that we see a formation of foot pads, or a bumble foot. It's really a bumble foot, so a higher foot that will cause pain, and also it's not stable for the birds to walk on. So as I said, we have high stocking density, high water intake, coccidiosis, dysbiosis, infectious diseases. All of that play a very important role here in the humidity of the litter. And this just to say that is very important to understand that is a multifactorial disease that has a huge impact in that. So what can we do? Well, I like to look at the causes and go one by one to define what we can do. We can remove wet litter. This is something very common, and mix the litter every day. Although it's a very good practice, although we have to do it every day, because if we don't do it for a long time and then you do it, there's ammoniac concentration and deposit in the litter. And if you do it in a closed house, the environment it gets a bit worse. So that's important to take in account. Adds newer litter as well. Replace broken light bulbs right away to make sure that distribution of chickens is even as well. Prevent kicking of the litter, prevent cold spots due to cold incoming air or draft, prevent water leakage from the drinkers as well. So everything that, let's say, plays a role in the humidity of the litter. We created this decision tree to help us decide what we have to do when we have wet litter. And the first thing that we have to do is to evaluate, well, first of all, and before this, look at the management in the house and see if there are any causes or easy fixes that we have or that we can have that will improve wet litter. But after that, we look at the score of bacterial enteritis and coccidiosis. The score of bacterial enteritis and coccidiosis is the way that we have to assess gut health in chickens. Without going to into much detail, we have several indicators that we will see in the chickens or in the guts of the chickens that will tell us what's the severity of bacterial enteritis that we have in our birds. And same thing for coccidiosis. After we have these indicators, we use them to define what will be our next steps. What do I mean with this? So depending on the severity of the score that we did for bacterial enteritis and for coccidiosis, we define what type of actions we will have. So if it's a higher score, we go for a veterinary indication where we have to control coccidiosis and bacterial enteritis that has multiple causes as well, being one coccidiosis, in which we should see the score as well, and then take action either on the anticoccidial program or vaccination, depending on the type of birds that we are talking about and type of production. Virus, where we check the status of the breeders and disinfect. And Hilda will touch a bit on that as well. Feeds, we have to look at the additives, the structure, the NSPs, mycotoxins, well, everything that can play a role on the quality of the feed. And if this score here is low, then we have a non-veterinary indication. So there's not like a health-linked issue with this, or the cause is not linked with health, and it should be more linked with management, where we should look into litter and feed and water relation as well. So in a very brief note, also important to know that ionophores or intoxication might happen as well, and this can be caused by ionophores. In this case, it refers to a neurological intoxication, where we see microscopic lesions in the peripheral nerves in broilers due to use of lazalocid and rosarsenone. There we have several reports of several animals that have high sensibility. Chickens are not the highest sensibility animal on when we refer to ionophore intoxication, but we do see that, and it's important that we mention. Besides that, ionophores also have a big impact on or they can have a big impact on the humidity that we have in our litter. So it's also linked with wet litter. We see for a fact that monensin and lazalocid have an impact on the humidity of the feces. In this case is here. Well, first of all, they have an impact on the coccidiosis, but also on Clostridiacea and on the bacterial enteritis levels that improves or not the litter condition. But on the other hand, ionophores, such as the name says, ion, they act by creating an imbalance on ions in coccidiosis or in coccidia. which sometimes also affect at some level the host, which in this case is chicken, which will then lead to sometimes an imbalance on humidity in the litter. So, for instance, monenzin is a very well-known product that we use in winter because it improves litter quality, so it decreases the humidity of the litter. But in all of that, very important to mention that still good rotation is required to safeguard anticoccidial efficacy. With this said, my part ends here. I hope that I didn't exceed too much my time. Thank you very much again for taking the time to listening to me. And I'll pass the word to Hilda. I'm open to any questions at the end if you have them.
Thank you so much, Dr. Tiago, for the very insightful presentation. I'm sure most of the audience got very important information from your presentation, especially regarding the non-infectious causes for locomotive diseases in poultry. So our next speaker will be Dr. Hilde van Meerhag. I hope I told your name correctly. So Dr. Hilde is working as a poultry consultant for VetWorks, a group of poultry veterinarians giving technical support to the pharmaceutical industry and poultry integrations worldwide. She is also involved in study projects on hygiene and food safety and health issues in partnership with the Faculty of Veterinary Medicine, University of Ghent. Currently working on EU Net Pol Safe project to follow up poultry farms and hatcheries in Belgium. As an academic advisor of the Faculty of Veterinary Medicine, University of Ghent, and a course master in WVEPAH, which stands for World Veterinary Education in Production Animal Health. She is involved in poultry trainings and teaching students and poultry professionals on poultry health issues. Dr. Hilde is also the president of the Belgian Hatchery Association since 2014. So today she is with us. Thank you so much to talk about infectious locomotor problems, an update on pathogenesis, control, and prevention. So over to you, Dr. Hilde.
Thank you very much for this kind introduction. And first of all, I want to thank everybody for participating, and also again say what Tiago said, and we were very happy to be in Sri Lanka, meet you all, and we were very well received. I thank you for that. So let's start on my topic is infectious locomotor problems, pathology, pathogenesis, because we learn a lot, and also because I chose this topic, locomotor, because we did see when we went to the farms in Sri Lanka, we did see some pathology there that I think might, this talk might help you to solve. So Tiago explained the non-infectious. I will concentrate on the infectious and on the new things. I'm not going to repeat everything that you know already. So I will start with arthritis and tendinitis, where the pathogens that contribute most is Mycoplasma, Gallisepticum, as well as Synoviae. And I know you try to control Gallisepticum, but it's still quite present there. But don't forget Mycoplasma synoviae, which for locomotory has a very, some of these strains are really have a tropism for the joints. So that's why it's important to always keep it in mind. And then reovirus. And then I'll continue with what Tiago also started to explain, the bacterial chondronecrosis, where we have different types of pathology. So first, mycoplasma. Some of these strains are really arthropathic, meaning that they have a preference to go to joints and tendons. So in the pictures you can see here some joints affected by mycoplasma, where you can see it starts with foamy, not really too much yellow pus, but the first thing, if mycoplasma will be first, and then on top you of course can get many other pathogens, E. coli, enterococcus, staphylococcus, but very often on the base is mycoplasma. So always make sure that you include it in your diagnostic plan. Because mycoplasma, as you know, can be transmitted not only horizontally, but also vertically. So in fact, the disease comes from the breeders. And then once you have it in your flock, vertically, it will start transmitting horizontally also, systemically, and go to the joints. So sometimes the signs are not too obvious. It will start with some bad performance, loss of conditions, but then you can see at one stage, you can see those swollen joints, mainly foot and the hock. Diagnosis, the best is, if you have a problem, is PCR, but ELISA can also give you an indication of an infection that was there some time ago. So what can we do? Hygiene, biosecurity for all diseases, but for mycoplasma definitely is very important. We have some antibiotic treatments that we can do, but if you start on the breeders or layers, you would have to repeat it regularly, which is something that we try to refrain to do, to use too many antibiotics. But we have macrolides, thiamulin, doxycycline, which has a very good synergy with macrolides to use for mycoplasma. And then we also, that's the new thing, I think, is vaccination. And we can vaccinate with live vaccines the breeders to protect the progeny, in this case, then the broilers. And I just want to share this experience, what we did in Belgium. We started in 2012, starting to vaccinate the broiler breeders with a live vaccine against Mycoplasma synoviae. And you can see in the graph here, what I want to show is before vaccination, the breeder prevalence of MS, and then only after the start of vaccination, you can already see from 2011 to 2012 that there is a big reduction in the prevalence of MS positive flocks. And we also saw the effect on the broilers. We saw less problems with, from vaccinated breeders, we saw less problems in the progeny, the broilers, with respiratory and locomotory problems. So that also means less use of antibiotics. So I think this is really a way to go forward. And then another one that we have recently done quite some practical work on is avian reovirus. You know, reovirus associated with runting and stunting and malabsorption, these flocks where you have bad uniformity, very small chicks that never grow. And it's an enteric virus. Then it also can give some respiratory problems, but what we focus on here is the locomotory pathology that it can cause arthritis and tenosynovitis. On the picture, you can see this is from a trial that we did in our research center, Pool Farm, where we infected them with Reo, and you can see the swollen footpaths and the swollen hocks that it can cause. The main problem with Reo is that we have, as you can see here in that phylogenetic tree, is that we have so many clusters. And depending, and this is what we are now going into, because we have some vaccine, but they are all from the same cluster 1. And the work that we did is to look in the field which types of Reo we find in the broilers, but also in the breeders. And we see that the clusters that we find are very different from this cluster 1. So to protect, the idea is that you protect the progeny, the broiler, by maternal antibodies from the breeder. So only if it's a cluster 1 will the commercial vaccine be very useful, because there's no perfect cross protection. And so that's why we try to vaccinate now with autogenous vaccines, because the pathogenesis, again, is you have vertical transmission, and once it's in the flock, it can spread horizontally. Then you get systemic and infection of the tendons, and sometimes also the other pathologies, but I focus now on the locomotor. So your diagnosis, clinical signs are not always that obvious. You can do virus isolation and detection, and you can also do PCR. So how to look at this? Again, we look for vaccination or protection of the breeders for the progeny with maternal antibodies, but we have to make sure that our vaccines meet the field strains. And also something, we have to aim for high titers before they start production. Otherwise, you will still have some part of the production cycle of the breeders where the broilers will not be protected. So standard procedure, what we do is you can do a live vaccine at 8-10 weeks, and then complete with a booster at 16 to 18 weeks with an inactivated or an inactivated but autogenous vaccine. That is our best choice. So that's Mycoplasma and Rio, and then I want to focus on the other pathologies that we see, infectious, this where we have osteomyelitis with femoral head necrosis, kinky back, and osteomyelitis also. So I focus a bit on enterococci because they are like where new research is going on, but it can of course also be Staphylococcus, Streptococcus, and other bacteria. And because we see, Thiago explained why, we see more pathology due to what we call bacterial translocation. Commensal bacteria, or bacteria that are your normal gut flora, you always have, we know more and more that we have a lot of good and bad bacteria, but the commensal ones, those are the ones that we want to favor. They become, for some reason, systemic and pathogenic. And that will then cause this bacterial chondronecrosis. So necrosis of your cartilage, and then afterwards you get osteomyelitis. With, you can see the pictures here, we see femoral head necrosis, and then also infected tibial dyschondroplasia, because one thing is the mechanical, what Thiago explained, and the defects in the growth. And then on top of that, you can get this infection with pathogenic bacteria. Okay, so this is a bit explaining, and we have bacteria that can enter the body of the chicken because they can go through the skin, in the mouth, footpath, respiratory, but mainly the digestive tract, where you have these bacteria that will then circulate in the blood, become systemic. And normally you should have an immune system that can remove these bacteria, so that it doesn't attack and doesn't provoke pathology in the bone. But there, the fact is that we have, in these cases, these locations where we find it, the femur head, the tibia, or the spinal places, where you have microtrauma. And then you have microtrauma, the bacteria will reach the bone, and our immune system is not adequate to do phagocytosis and to in fact remove these bacteria from the system. Because of those places, Thiago also explained, some places of the bone and the joints, we have very poor vascularization. so the immune system doesn't reach. And that is why we then get these leg problems. A picture that Thiago already showed, but just to show, we have a fast-growing broiler with a skeleton that has to keep pace. So that's why the feed is so important, that there is enough minerals. But the delicate places are where there's a high growth and a high weight. So that is your hip, the femoral head necrosis, also your knee, and the tibia, the hock, and the foot pads. So these are the, because there's a lot of strain and fast growth. And typically for this kinky back, where you have vertebral osteomyelitis of T6, and that is exactly, you have the fused part of T2 to T5, and what we call notarium, and then the sacrum, and the T7 that is fused with the sacrum, the synsacrum. And in the middle of that, you have this free floating T6, which is really a weak spot, specifically because of the high growth and the gain of weight in our broilers. So you have some kind of continuous friction there. So that's where you get this microtrauma, and that's where your Enterococcus secorum, but also other enterococci, can cause this abscess with a pressure on an abscess that gives pressure on the spinal cord, and then will cause paralysis and lameness. And if you look at the pathogenesis, you first have a septic phase, when and that starts really very early in life. So the septic phase is when your Enterococcus secorum, that is in the intestine, will start becoming systemic and cause pathology there. You already see, before you see pathology, they can already isolate from the yolk sac on day 3, this Enterococcus secorum, on day 6 from the liver, and also from the pericard. Then the next step will be, because these are things that more systemic pathology, yolk sac infection, perihepatitis, pericarditis. For that reason, you will get a loss of homogeneity after 2 weeks, but it's in fact only later, when you have this big growth and more weight, that you will see lameness from day 17 in this study. So, but it's important to realize that, in fact, it starts very early in life. So the systemic phase, and later on, you will get the pathology that we see, the bacterial chondronecrosis in different places, femoral head necrosis, tibial dyschondroplasie, and this enterococcal spondylitis with an infection. So these pictures are from Wiedemann, who did a lot of research on that. So the etiology is on the side of Enterococcus, it's a gram-positive coccus, it's facultative anaerobe. Most of these, in most mammals and birds, you will find Enterococcus as a normal pathogen, a commensal, in the gut. Because we also find Enterococcus secorum from the intestinal tract in healthy birds. And in our experience, because there's a lot of focus on secorum, but also fecalis, faecium, irae can cause this pathology. But there's a difference. Some of these enterococci can stay and not be pathogenic, but there's a difference in the colonization and the virulence of these different strains. Some of them become pathogenic, and I think there's two sides. There's the pathogen that has more virulence factors to become and to cause harm, but there's also the host side. Our broiler that is genetically really made to grow and to, but has lost a bit on the side of innate immunity. So we see that the strains that we isolate from pathology, in case of pathology, are different from the commensals. So from now, I'm trying to say that this is an ongoing story. Maybe in some time we will have different findings, but until now, we've not been able to prove that there is a vertical transmission from the breeder or from the hatchery. Mainly it's horizontal. So there's an oral fecal route. It can also be aerogenic or through dust that you have transmission. And then you have this translocation from the intestinal lumen. So we, as we showed in the study, the same ones that we find in the gut, we later find in the yolk sac, in the liver, the spleen, and in the lesions. What we do see in practice is that very often these Enterococcus outbreaks are linked to a farm. So that's why we have to start thinking, where do they survive? Maybe it's through insects. I personally think that water and the water line, the biofilm that you find there, is very important. And we also see that coming back in the virulence factors of these pathogenic enterococci, that they have a specific gene that makes them more efficient in making biofilm. Then if we look at the symptoms, as I mentioned, 2 phases, first septic, latest we see the lameness. So first, in the first 1 to 3 weeks, we will see loss of homogeneity, not big mortality, but constant, a few dead birds. And then we start to be able to isolate even from asymptomatic birds, which don't look very sick, that in yolk sac, liver, and spleen, and we get pathology from then on, pericarditis, splenomegaly, perihepatitis. Each time we also, we have to differentiate from colibacillosis, because it can look similar, but also you can have secondary infection with coli, of course. So in the first phase, and in fact, it's only when the birds become more heavy that we start seeing femoral head necrosis, kinky backs, and then what Tiago also mentioned, the skin scratches. So I think femoral head necrosis is one of the most common cases of lameness in broilers. Again, I focus on Enterococcus here, but in case of femoral head necrosis, usually you will find Staphylococcus, but can also be E. coli. But the pathogenesis very similar. You have bacteremia, septic phase, then it infects the growth plate, and then it becomes osteomyelitis. In this case, you have the femur head that is coming loose. Predisposing factors are many. Again, water quality, in my opinion, is a very important one. See it starting from when the 3-4 weeks, and this typically what you see the bird in the picture, the wingtip walking. So diagnosis, you can see normally the cartilage should be, when you dislocate at necropsy, when you dislocate the hip, you should see a shiny white color. Anything else, and the cartilage staying inside, or as you can see here, really disintegration of the proximal femur head is a sign of femoral head necrosis. And from there you can do bacteriology and isolate or Enterococcus or any other bacterium. And then this specifically what we observed in a couple of farms also in Sri Lanka is this kinky back, Enterococcal spondylitis, where we know if at necropsy you see that the abscess is located at T6. Enterococcus secorum, a lot of papers about it, but as I mentioned, we find also other types of Enterococcus, and the pathogenesis is microtrauma in the cartilage at that vertebrae. You get a spinal abscess, and that gives you compression of the spinal cords leading to paralysis. And typically, if you touch the feet, they don't respond because they don't feel it because of that. And these typical pictures of the birds sitting on their backs with their feet pointing forward. So you can already be quite sure of your diagnosis if you see the clinical picture, but at post-mortem, this is what you see. You find an abscess in the spinal, in the vertebrae, and that gives you a compression of the spinal cord. You can isolate, to differentiate. You have Malditov technique. You can also do PCR. And then for research purposes, we do genotyping and we do virulence assessment, because we know a specific Enterococcus strain will have specific virulence factors. We have a problem with the treatment here, because once you see lame birds, it's too late. In fact, because of what I explained, the pathogenesis, the same goes for trying to reach with your antibiotic that place. There's not a lot of circulation there. So that's why that makes it difficult. And then we checked for antimicrobial sensitivity, and we see a lot of antimicrobial resistance in these enterococci. What we tend to do, and which is, well, we tend to go away from that because we don't want to give antibiotics in the first days, but that was very effective. If you look at the pathogenesis, and we have this septic phase, if you can avoid that, and we used lincospectin. But if I look at the sensitivity patterns, a lot of these enterococci are resistant to lincospectin, and it still worked. So maybe it's a different mode of action. It's more anti-inflammatory. It's more balancing the microbiota so that the Enterococcus cannot become systemic. That is something we don't know. Just an example of, we have done sensitivity tests on Secorum fecalis and Faecium enterococci, and you see that they are not, the resistance pattern is not the same for the three pathogens. And if you look at lincospectin versus amoxicillin, in fact, amoxicillin is more sensitive than lincospectin. But in any case, the results at the start, if you use in the first, is better with lincospectin. I can't really explain. So prevention. We've also tried vaccination of the breeders, again, with the idea we can protect the broiler with maternal antibodies. And we've tried it, but there's also some papers about that, but until now it has been not successful. But maybe we didn't have the right Enterococcus strain. So this is still ongoing research. So the only thing we can do is to avoid this early bacterial translocation from the gut to become systemic. And therefore, we have these new innovations in on-farm hatching, early feeding, but that is something I think that will help, or we can see that it helps. The idea is that with early feeding, there is early intestinal development, not only of the intestine, the morphology, the villi, but also of the immune system. And in that way, you can mitigate inflammation and immune response. Because we know, very important to avoid this bacterial dislocation is to have early closure of the tight junctions amongst the epithelial cells in the gut. And one thing that is negative for this closure of tight junctions is also high temperature, heat stress. And then I mean heat stress in the beginning. And we know that our broilers today, compared to those that we had 20 years ago, produce more metabolic heat. And this also happens in the hatcher and in early life. So we have to avoid heat stress there during incubation. And also it's important that they have enough heat because they cannot produce their own heat at the start, but don't overdo it. We used to have temperatures of 36 in the house. I think that's too much. So let's say what we do now is we keep the house temperature in the environment at 36 and the floor temperature at 28. And we gradually make it cooler. So from 34, day 1, 32.5, day 3, 31, and day 7, we aim for 28, 29 degrees. To really control that, the best way is to look at cloacal temperatures. In the first days, it's a good practice to take 20 chicks regularly and check the temperature. It should be the first days between 39.5, 40.5, and after that, 41. So different ways, I'm not going to go into detail of early feeding, can be in the hatcher already, water and feed, important, always water and feed. During transport, what you see here is small turkeys with gel application that also gives feed and water, and then different forms of on-farm hatching, where the idea is you put the incubated eggs at transfer at day 18. Instead of putting in the hatcher, you put them in the house. You can provide, and they will hatch from day 19, 20, 21, but they immediately can have access to feed and water. And of course, also, they have less stress. They don't go through the handling in the hatchery. So as a conclusion, our time is limited, but I wanted to give you some new insights maybe on locomotory problems. Nutrition, management, genetics, and pathogens are the ones that are responsible for the locomotory diseases that we see. Financial loss can be important because not only some birds we have to cull or they will be condemned at the slaughterhouse, we have some mortality due to locomotory problems, but it will also always impact your performance because it has an impact on feed conversion rate because of the inflammation that is there. Whatever the cause, you have to try to find, make a good diagnostic plan, but intestinal health and litter quality play a very important role in aggravating locomotory problems. And I think we need to focus on early feeding and hygiene to avoid bacterial translocation. So with that, I want to thank you for your attention, and I will be very happy to answer some questions.
Thank you very much, Dr. Hilde, for the very lovely, clear presentation with the pictures and clear explanation. So we have questions, I think, for both Dr. Hilde and Dr. Tiago. Any of you can answer. So one question is like, does the calcium and phosphorus imbalance in the diet lead to non-pathogenic locomotor disorders in broilers?
I think that one is for Tiago.
Yeah. Yeah, I think we showed that. We showed that the imbalance of or the lack of ability of the broilers to maintain the balance of calcium and phosphorus can cause that stevia dyschondroplasia, the rickets that we see, which can have a genetic cause linked with that, or can also be played, or can also be linked with the management issues.
I think it's still very often it is mistakes or lack in the feed composition and the structure of the feed. We also saw sometimes a lot of powder in the feed pans. So that means that your feed is not well made, and that your minerals are there, but chicks don't eat dust. This powder, they will not take it up. And so if your calcium phosphorus is there, you have a problem. So the next one
Yes. Shall I read it? Okay. So we observe a lot of lameness issues during the first and second weeks in broilers and broiler breeders in Sri Lanka. Could you please give us the most probable differential diagnosis for the above observation?
If it's in the first weeks, you also have to look at how your chicks come from the hatchery, and that's also an important one. Do you see spread legs? And that can be related to bad hatching, or not putting them in a nice box where they cannot have these spread legs. And if you say lameness, then you have to, that's what I think, you have to make up a plan, like we did in the presentation. Tiago gave you the non-infectious and the importance of intestinal health. And then you can also, if you really see swollen joints, or you can take samples and try to get to the bottom of this. But it can be, I think Tiago explained very well how complex it can be. It's not only Reo, Mycoplasma, Enterococcus, or that. What are the contributing factors? Why do you get, so wet litter, very important, environment, all that. So it's complex, but I think if you will get the presentation, if you try to work with specifically the decision tree that Tiago showed, I think gives you a very nice way to get to the bottom of your problem. Does that answer the question?
Yeah, thank you so much for the answer. So if any of you have any questions, this is the time that Dr. Tiago and Dr. Hilde will answer them.
If not, it was very clear.
It was
That's
very
a
clear.
good sign.
No, but if ever afterwards somebody has a poignant question, you can always send it by mail.
Yeah, indeed.
The sample to collect, that's a nice one. Well, one of the, you can of course sample the place where you have the lesion, but you will not always isolate the right pathogen. So as we saw, for most of these problems, there is a systemic cause. So a nice sample to take is bone marrow, because you can take a nice clean sample, you cut it, and in the lab, if you can, in the lab, you can even flame it to make it sterile, and then you put your swab inside the bone marrow. And if you plate that is a very nice sample to take, I think, for bacterial causes.
Mm-hmm.
And otherwise also, at the beginning, pericarditis, that's also a nice place to sample, because you can take quite a sterile, because one of the things that you must avoid, of course, is that you isolate a bacteria there, an E. coli, for example, that is not the cause. It's just a contamination from somewhere else. That's why I think pericards, the bone marrow, are nice samples to take from the femur, or yeah. Good.
Okay, thank you so much.
Thank you.
Any other questions?
It's also Sunday, don't forget.
Yes, and again, thank you so much for joining us, Dr. Tiago and Dr. Hilde, on a Sunday.
It was our pleasure. I think I can also speak for Tiago. We had a very nice time in Sri Lanka, and we look back with very good memories on you. We wish you all the best.
Thank you so much. Okay, so as there are no any questions, I will hand over the session to Dr. Kaundika. Thank you.
Thank you, Dr. Tushari. I think we have just completed a very interesting webinar today. In fact, this is the 11th of our international webinar series organized by Sri Lanka Veterinary Association. Many participants have joined through Zoom platform, and some have joined through SLV YouTube channel as well. So on behalf of the President and the 75th Executive Committee of Sri Lanka Veterinary Association, I would like to extend my sincere gratitude to the two eminent speakers today. To begin with, Dr. Tiago Rucha, Poultry Consultant at Vetworks, Global Technical Support and Business Development Advisor to the poultry industry. And also Dr. Hilde van Meijeren.
Yeah, I know. Dr. Hilde.
Yeah, Poultry Consultant at Vetworks, Global Technical Support and Business Development Advisor to the poultry industry. And also she is an academic advisor, the Department of Virology, Parasitology and Immunology of Faculty of Veterinary Medicine, University of Gent, Belgium. And also she is the president of Belgium Hatcheries Association. So thank you very much for the two eminent speakers for accepting our invitation and conducting an excellent presentation today on locomotor diseases in poultry. It was a very informative presentation. I'm sure all the participants gained a lot from your presentation, especially the poultry field veterinarians in Sri Lanka. And by looking at the presentations, I felt that we may need a lot from you in future. So we'll do the needful, definitely. So thank you, Dr. Tiago and Dr. once again for your valuable contribution for today's presentation. And also it is my duty to thank our moderator today, Dr. Tushari Guruwardena, the Senior Lecturer, Department of Veterinary Pathobiology, Faculty of Veterinary Medicine and Animal Science, University of Yardenia, for doing a wonderful job. And last but not least, I must thank all the participants who have joined today for today's webinar in different parts of Sri Lanka and also from overseas, despite your busy schedules. Thank you very much, everybody. So this is all for today's webinar. And until we meet from our next webinar, it's goodbye to you all. Thank you very much and have a wonderful day. Thank you.
Bye-bye. Bye. Thank you very much. Thanks.
Bye.
Bye-bye.
Bye-bye.
Bye.